There's a number that most patients over the age of 60 are told to chase: 120/80. And I need to tell you something that almost nobody explains properly. For a huge number of people watching this right now, chasing that number could be putting you in more danger than the high blood pressure itself. Not a little more danger. Potentially fall on the floor, hip fracture, lose your independence danger. Here's the problem. That 120/80 target wasn't built for someone your age. It was built for a 40-year-old. And if you're 60, 70, or 80, and your doctor is pushing you toward that same number without asking the right questions first, there's a real chance it's working against you instead of for you. By the end of this video, I'm going to walk you through exactly why this happens, show you two real patients I've treated with the identical blood pressure reading who needed completely opposite treatment, give you a 2-minute test you can do at home to check if this applies to you, and share a finding near the end that every adult over 60 on blood pressure medication needs to hear before their next appointment. Before I go further, if this is the first time anyone has explained blood pressure to you this way, hit subscribe now. I'm building this channel around one mission: getting real, individualized information to older adults, instead of the same recycled, lower it at all costs advice. You subscribing is what gets this in front of the next person who needs to hear it. Okay, let's get into why this number is so misunderstood. Most people think blood pressure is simple. High is bad, low is good. End of story. When you're younger, that's mostly true. But once you move into your 60s, 70s, and 80s, your blood vessels are physically different than they were at 40, and that difference changes everything about how this number should be read. As you age, your blood vessels get stiffer, less elastic, slower to react to changing demands in your body. That stiffening is part of why blood pressure climbs in the first place as people get older. But here's the part almost nobody explains. That same stiffness also makes your body significantly worse at adjusting blood pressure moment to moment. When you stand up, when you're dehydrated, when you're overheated, or when you haven't eaten enough. There's a name for this: orthostatic hypotension, and most people have felt a mild version of it without knowing what it was. You stand up too fast and the room goes hazy for a second. You step out of a hot shower and suddenly feel lightheaded. That's your blood pressure system failing to keep up with your body's demand in real time. In a 40-year-old, that might mean 1 or 2 seconds of dizziness, nothing more. In a 75-year-old, that same moment can mean a fall, a hip fracture, a head injury. In some cases, the beginning of a total loss of independence. And this is the part current medicine does not explain well enough. We've spent years correctly warning people about the dangers of high blood pressure. Strokes, heart attacks, kidney disease, all true. But what gets left out is this. In older adults specifically, overtreating high blood pressure can sometimes be more dangerous than the blood pressure itself. Let me show you exactly what I mean with two real patients I've treated, both around 75 years old, both with the exact same blood pressure reading, 142/92. Patient A is active, walking regularly, gardening, sharp as ever, tolerating her medication with 0 symptoms. No dizziness, no falls, no balance issues. For her, treating that 142 genuinely lowers her stroke risk over the next decade. Her brain, kidneys, and heart benefit meaningfully from bringing that number down. Her body has the resilience to tolerate the medication without her regulation system falling behind. Patient B is more frail, managing several chronic conditions, already struggling with balance, gets dizzy standing up from a chair. For him, aggressively pushing that same 142 down toward 120/80 could do far more harm than good. Every additional point of reduction increases the odds that his already struggling regulation system can't get blood to his brain fast enough when he stands. The exact medication that helps patient A live longer is the same medication that could put patient B on the floor. Same number on the cuff. Two completely different risk profiles. And here's what genuinely concerns me as a primary care provider. Patient B, the frail, balance-struggling patient, is almost always the exact person excluded from the studies that built these blood pressure guidelines in the first place. That's the single biggest reason a one-size-fits-all target makes no sense for anyone over 60. If you've made it this far, I want to ask you for something small. Drop a comment below telling me, sitting down right now, do you know if you get dizzy when you stand up quickly? I read every comment, and it genuinely helps me know what to cover next. And if this video is already changing how you think about your own numbers, go ahead and hit that like button now. It's the single biggest signal to YouTube that this needs to reach more people your age. Now let's talk about what your actual number should be. I want to be clear before I give you a number. There is no single perfect target for everyone over 60. Anyone who tells you otherwise is giving you a guideline, not an answer built for you specifically. If you're over 60, generally active, and tolerating your medication well with zero symptoms, aiming for a systolic reading below 140, sometimes closer to 130, is a reasonable and well-supported target. But if your treatment is making you feel dizzy, weak, foggy, or unsteady, or if you've had any falls at all, or your blood pressure drops noticeably when you stand, that conversation changes completely. Your symptoms are telling you something the number on the cuff cannot. And your symptoms should always win. If that's you, your target may not be able to go down into the 130s. It may need to stay in the 140s, specifically so you avoid dizziness, avoid orthostatic hypotension, and avoid a fall that changes your life. That is okay. That is not failure. That is your body telling your doctor exactly what it needs. Here's how to check if this applies to you right now at home. 1. Sit down and take your blood pressure. Record the number. 2. Wait 2 minutes. 3. Stand up and take your blood pressure again within 1 minute of standing. If your systolic, the top number, drops more than 20 points, or your diastolic, the bottom number, drops more than 10 points, and you feel any lightheadedness during that is orthostatic hypotension. Write that finding down and bring it to your doctor by name. Say the words orthostatic hypotension. It changes the entire conversation about what your target should be. To be clear, this does not mean high blood pressure doesn't matter. It absolutely does. Untreated hypertension silently damages your blood vessels for years and genuinely raises your risk of stroke, heart attack, heart failure, and kidney disease. This isn't permission to ignore high readings. It's permission to make sure your treatment is built around you, not a number designed for someone 20 years younger. If you want to start lowering your blood pressure naturally, I've linked 5 supplements below that the evidence genuinely supports. Several of them, combined, can perform close to what a prescription does. You'll find that link in the description. And if you want the complete, deeper plan, more than any single video could ever cover, I put it all together in a free resource called the Blood Pressure Blueprint. It's free, and the link is right below this video. Last thing, in my next video, I'm covering the single best way older adults can lower their blood pressure naturally, for anyone hoping to eventually get off their prescription. If that's you, subscribe now so it lands in your feed the moment it's live, and I'll see you there.